CS 3D Imaging, utilizing the 3D tools to analyze 3D volumes recorded class. This recorded class is designed for clinical team members and provides instructions on the CS 3D imaging software tools. By the end of this class, you should be able to utilize the reformatting tool, create a reconstructed panoramic image, trace a nerve canal, perform measurements, and place an implant.
Utilizing the reformatting tool. To utilize this tool, you must first activate the reformatting tool for the specified image type. This is done in the preference settings of the CS 3D imaging software. For more on preference settings, refer to the CS 3D imaging software Setting Software Preferences Recorded class. Once the tool is activated, when the specified image type is open, the reformatting tool window appears. The reformatting tool enables you to correct patient positioning of an image. Use the endpoints of the gold control points to adjust the axial view. Note the inner dots will allow for an angle adjustment of each volume. The purple control points will adjust the coronal view, and the green control points will adjust the sagittal view. To crop a 3D volume, select the crop box option. To display only part of the anatomy, adjust the white dots around the 3 MPR slices. With the formatting tool, you can also export smaller views of an image. Adjust the voxel size in the lower left corner of the reformatting tool window. Note, to increase the speed of opening and using the 3D imaging software, select a higher voxel size from the voxel size drop-down list. Add a name in the volume name field. The window options are Reset. Resets the formatted 3D volume of the original images. OK saves the reformatted options. A new folder is created in the patient's image folder. And Skip closes the reformatting tool window and opens the 3D volume without reformatting it. Creating a reconstructed panoramic image. To create a reconstructed panoramic image, select the Curve Slicing tab. Use the axial slider to adjust the axial view to the desired location. In the Tools panel, activate the arch icon to manually create an arch. Click on the areas of interest to set the control points. Double-click the last control point. The reconstructed panoramic image is now displayed. To present the reconstructed panoramic view as a traditional panoramic image, set the integration to approximately 10 to 15 millimeters. To control the upper and lower limits of a reconstructed panoramic image, select the Scout tool located in the Adjustment panel. Use the white horizontal lines to define the upper and lower limits of the reconstructed panoramic image. This also defines the limits shown for transaxial view and 3D scene. Click OK. The images are displayed in the new limits. To set the transaxial to an area of interest or an angle of interest in the reconstructed panoramic image, click and drag the endpoints, represented here with the letter A, and move the line left or right. To adjust the angle of the transaxial view, click and drag on the inside dot, represented here with the letter B, the blue line to change your angle. To adjust the depth of the transaxial view on the axial slice, click and drag the endpoint to expand or contract the line. This is represented by the letter C. To evaluate the anatomy for an extraction or an implant placement, you might need to locate the mandibular nerve. Using the Nerve Canal tool, you can trace a nerve canal on a reconstructed panoramic image. To make sure you trace the nerve canal accurately, select the best resolution possible in the Set Integration option. Adjust the curve so the nerve canal you want to trace is clearly visible by clicking and dragging on the red anchor points on the curve. Finally, align the transaxial with the mental foramen. We'll start tracing in this view, but we will continue in the reconstructed panoramic view. In the Tools panel, activate the Nerve Canal tool. Click in the center of the nerve canal opening at the mental foramen in the transaxial view window. Once the nerve canal is visible in the reconstructed panoramic image, continue tracing in that view towards the condyle. Again, click in the center of the nerve canal and continue to click to add points. Double-click when you've reached the end of the nerve canal. To trace the nerve canal on the other side of the jaw, reactivate the tool if desired. To verify placement, align the transaxial with each control point along the nerve canal and modify if necessary. To hide or display a trace, click alongside the trace in the Tools panel you want to hide or display and select the eyeball icon. By default, nerve trace is displayed in orange. To change the color, click the orange square in the nerve canal section of the Tools panel. Select a desired color and click OK. By default, the diameter of the nerve canal is 2.5 millimeters. To adjust the nerve canal diameter, click alongside the trace you want to adjust in the Tools panel. Select the diameter you want to use for the selected trace and select OK. To delete a trace, click alongside the trace in the Tools panel you want to delete and select the trash receptacle to remove the selected tracing. Performing measurements. You can perform measurements on the CS3D Imaging MPR images using common measurement tools. To draw a straight line measurement, activate the measurement mode in the Tools panel. On the MPR image in the workspace, click one end point of the line. Move the mouse pointer to the other end point and click again. The line is displayed with its measurements in millimeter. Note, the straight line measurement with an icon of a thumbtack enables you to draw repeated separate lines without reselecting the tool. To draw a polyline, activate the polyline measurement mode in the Tools panel. On the MPR image in the workspace, click the first end point. Move the cursor to the first intermediate point of the line and click. A line segment is displayed. Repeat to create as many segments as you want. Double-click to create a final endpoint. Measurements in millimeters are displayed for the entire polyline and for each segment in the Tools panel. As before, a multi-polyline tool is an icon with a thumbtack over it. It enables you to draw repeated polylines without reselecting the tool. To draw an angle, activate the Angle mode in the Tools panel. On the MPR image in the workspace, click one end of your angle. Move the cursor to the vertex of the angle and click. A line is displayed. Move the cursor to the end point, the second line of the angle, and click. A second line is displayed, with the angle in degrees displayed in the Tools panel. As with the other measurement tools, the icon with a thumbtack over it for angles enables you to draw repeated angles without reselecting the tool. Placing an implant. Before you start, align the transaxial location in the reconstructed pan view. This will be the location of the implant. Use the outer control points to adjust right and left, and the inside control points to adjust the angle. In the Tools sections, activate the Implant tool. The Implant Library window is displayed. You can select an implant from the list. For more on implants and implant libraries, refer to the CS 3D Imaging Software using the Implant Library recorded class. Here, we'll select an implant from the list and select OK. The implant is placed in the transaxial slice and is displayed in the reconstructed image as well as the axial plane. If necessary, you can adjust the position of the implant. Move the implant in the axial slice, maintaining its orientation using the center dot. It may be necessary to hide the arch trace. To do this, select the eyeball icon for the arch in the Tools panel. Move the implant in the reconstructed panoramic image using the dots, or move the implant in the transaxial view using the dots. After making adjustments to the implant to ensure it is visible in all of the views, select the Center at Implant option in the Tools panel to center the implant in all views.
Now you should be able to utilize the reformatting tool, create a reconstructed panoramic image, trace a nerve canal, perform measurements, and place an implant.